All right, so last time I talked to you a little bit of a reason to come see us. Now I kind of wanted to talk a little bit about what we would do for you in the case that the tonsils or the adenoids are overgrown or those recurrent infections are causing so many issues that it's time to get them out. Performing a tonsillectomy and an adenoidectomy, it's a pretty standard procedure. For us, it takes about anywhere between 15 to 25 minutes to do. We do what's called a subcapsular technique. So best way to explain it is back in the olden days, I used to kind of carve them up from the bottom up. Now what we do is we use a debrider to kind of shave it down so we get to the base and there's less risks of bleeding. This is a day surgery, so the patient will be under general anesthesia, but it's something where you go in the morning, check into the hospital, and by the time that the afternoon comes, you're ready to go home. The recovery process that you can expect, it'd be about 3 to 4 days of a real bad sore throat. What we're really looking for is waiting for the fossa to scar over. And once that happens, that's when usually everything gets better. Usually we'll recommend a soft food diet to start off with, but more often than not, after 3 to 4 days, patients are ready to go back to their regular diet. A big benefit that you see from this, the analogy that we use all the time is if you get the house out of there, people won't be living there anymore. So you could think of it the same way with infections. If we remove the glands, then we will no longer have those infections so easily occurring because they're not going to have anywhere to grow. Another thing that some people sometimes question is, what was the point of having the tonsils? I think that their immune systems will be affected a little bit more with those being gone. That's not necessarily the case. These glands are almost like a remnant for us. So the big takeaway from this procedure really is going to be, now that we got those out of there, those infections should definitely slow down to virtually zero. And number two, if they have obstruction or sleep apnea, anything like that in a child were to be the issue, then that's where you see that big benefit, because that obstruction's gone. So the air flow should be doing a lot better for them. The snoring, the pausing, the sleeping, all that should be doing a lot better.